Hello, I'm Mark Gillard, Orientation and Mobility Services Specialist at Guide Dogs for the Blind. Welcome to this educational video about the Juno exercise. The first objective of the video is to break the Juno exercise down into component parts, to talk about the footwork, hand signals, body positions and verbal commands a student needs to learn. The second objective is to show how to teach the Juno exercise accurately and efficiently. And the final objective is to talk about some of the common challenges and considerations. An important part of the video is the role of residual vision. With the majority of students now training with GDB having some remaining vision, teaching strategies applicable to these students are presented.
Handle grip, challenges and considerations. Some students may have limitations or difficulties using their left hand or arm. For example, students may have missing fingers, arthritis, or peripheral neuropathy. Cerebral palsy or brain injury can cause muscle spasticity or paralysis. Injuries to the wrist, elbow, or shoulder may cause pain, flexibility, and range of motion issues. For difficulties with gripping the handle, an occupational therapist can provide valuable input. For example, an OT can modify the grip so it is more comfortable for students with arthritis in their hands. If the challenges are too painful or difficult to overcome, this may lead to consideration of matching the student with a guide dog trained on the right. It is beyond the scope of this video to demonstrate the Juno exercise on the right-hand side, but put simply, the positions for left and right turns would be reversed. While the leash is not required to conduct Juno, modifications can be made in class training for students with physical limitations. For example, tucking the leash under the left index finger may be difficult due to physical issues or because of small fingers or hands. Giving the student a shorter leash that attaches around the wrist is a possible modification. Some students who are particularly anxious may grip the handle too firmly, at least initially. This can cause fatigue and soreness in the left hand, arm, shoulder, and upper back. A tight grip will also reduce the amount of tactile feedback a student will receive through the handle, affecting their ability to follow Juno smoothly and respond to directional changes. A tense arm can result in a guide dog pulling more strongly into the harness, which can be uncomfortable for the student and further increase their level of anxiety. Some guide dogs may react the opposite way and slow down or become hesitant. For all these reasons, it is important to assist the student to relax. Relaxation exercises completed before and during Juno can help. The halt position, challenges and considerations, coordination, and left-right discrimination. For some students, moving their legs and feet into the correct position can be challenging due to left-right discrimination or coordination issues. Students experiencing anxiety can initially confuse their left and right. Some may have problems with being able to remember a physical sequence due to anxiety-based short-term memory issues, neurological conditions, or cognitive decline. Repetition and breaking movements down into smaller steps can be effective teaching strategies for these students. Balance. Positioning the left foot slightly ahead of the right can make it difficult for some students to maintain balance. Students may narrow their stance, which will reduce the width of their base of support, increasing the potential of losing balance. Instructors should emphasize to the student to keep their feet shoulder width apart to maintain a good base of support. This is particularly important when standing on slopes or on uneven surfaces. For some students, it may be necessary to modify the halt position to maximize balance. For example, having the student use the right foot to probe instead of their left, or standing with their feet parallel to one another and shoulder width apart. Neuropathy, a prosthetic device, or a neurological issue may result in a reduction or absence of tactile information about the ground surface. Proprioceptive input about the position of the feet and legs can also be reduced or absent. Strategies to maximize balance and available tactile information should be used, such as probing with the intact limb in the case of a student with a prosthesis. Flexibility. The standard halt position sees the student standing at Juno's shoulders with their left arm almost straight and extended behind them, parallel with their left side. Students with flexibility or range of motion issues may find this position difficult, at least initially, and may benefit from exercises to increase flexibility, such as stretches completed before Juno and during the time leading up to formal guide dog training. As explained in the section about handle grip, if issues concerning the left arm, hand, wrist, elbow, or shoulder are too difficult to overcome, then it may be necessary to perform Juno on the right and eventually train the student with a guide dog that works on the right side. The forward command, challenges and considerations, speech and voice tone. The voice tone used to say the command Juno, forward, and for other verbal commands, needs to communicate an inviting and purposeful intent to the guide dog without being overly domineering or too passive. This is because in practical terms, the forward command is not a command at all, but an invitation to move into space. The guide dog should be able to refuse the command if moving forward would be unsafe, such as entering the street in the presence of perpendicular traffic, or if an obstacle was directly in front of the handler. This is known as intelligent disobedience. If the voice tone is too direct, the guide dog may feel compelled to move forward into a dangerous situation. Conversely, if the voice tone is too passive, the guide dog may lack command response and confidence in the handler. Some students may need to modify their voice tone. Recording the student's voice so they can hear themselves and practice on their own can be helpful.
Juno left.
Examples of students who may require additional assistance and practice are those with hearing loss or impaired speech. Some students with emotional issues may take medications to assist with emotional stability. Medications may cause a flattened effect, and a student might require feedback and assistance to modulate their voice. Students who are shy or lack confidence may also need additional instruction and practice. Students who experience difficulties or limitations with giving verbal commands can still communicate with a guide dog by using hand gestures, body positions, and the leash. Some students may have a reduced range of motion or coordination challenges in the right arm or hand. Because a verbal command is delivered simultaneously,
Scholar, forward.
It can be used to communicate to Juno in the absence of a hand gesture. The student with residual vision. A behavior common to students with residual vision is anticipating forward movement before Juno moves off. Using occlusion can teach the partially sighted student to wait until they feel Juno move forward before they step into space. The student who is anxious about walking through space or finds it difficult following Juno. After giving the forward command, the student needs to be ready to follow Juno when movement is initiated. Students who are anxious about moving through space may hesitate and need to build confidence. Some students may have a delayed response due to physical or neurological issues. Students can decrease their response time by transferring their body weight to the left foot while in the halt position. This will result in the initial right foot takeoff being smoother and faster.
Forward.
Following position, challenges and considerations. The student with residual vision. For those students with some functional vision, it is important for them to understand how and why they need to maintain a correct following position. A common behavior for a partially sighted student is to rely upon visual input rather than responding to the information felt through the harness handle. The student can move too far forward in their following position and overwalk the dog. This can cause safety issues and various undesired responses to develop, such as the handler having less time to respond to obstacles or elevation changes, and the guide dog slowing down and supplying less harness pull. Other behaviors that can affect following position observed in students relying on residual vision are not following their guide dog's movements when clearing obstacles, moving their body or right arm to avoid obstacles if the guide dog is not going to clear them, assuming a certain posture or head position because they are trying to use their remaining vision. Posture and head position can become problematic if they cause discomfort, balance, or mobility issues such as veering. The use of partial or total occlusion can assist the student with residual vision to learn to maintain correct posture, head, and following position. It is useful to practice Juno in various lighting conditions and at different times of day, depending on the nature of the student's visual impairment. For example, a student with retinitis pigmentosa will benefit from practice at night. It is also useful to practice in both indoor and outdoor environments. The student who is anxious about walking through space or finds it difficult following Juno. A student may be hesitant following Juno and fall back in their following position due to a lack of confidence or because they are inexperienced with non-tactile travel, which can occur when transitioning from the cane. A recent deterioration in functional vision or a rapid onset of vision loss can also contribute. A student who is experiencing fitness or physical challenges may find it difficult to maintain a correct following position or to keep a consistent pace. The right turn, challenges and considerations, not stepping back far enough or stepping back too far. Knowing how far to step back for a right turn can be initially challenging for some students. It is important for the student to step back far enough so that Juno has enough room to make the turn, but not too far back so they lean forward and become unbalanced. The goal is for Juno to pass directly in front of the student with a minimum of distance between them. The student being correctly positioned will reduce the potential of losing balance or an obstacle coming between them and Juno, which could result in a collision. The left turn, challenges and considerations. Not turning the body a full 90 degrees to the left. Some students may need assistance learning to turn their body a full 90 degrees to the left due to issues with body awareness, proprioception, or flexibility. Right and left turns, challenges and considerations. Sequencing. Both left and right turns involve the student performing a sequence of physical movements involving the feet, legs, arms, and hands. Students with learning difficulties associated with memory and sequencing may benefit from the instructor breaking the turns down into individual steps. Repetition and practice are also helpful. It is important to consider the overall goal when teaching students with learning difficulties and avoid becoming overly concerned with the exact sequence of physical movements. For example, some students may move their right foot before their left when executing a right turn. As long as the final body position is conducive to a safe and effective turn, this will not be detrimental. Balance. Instructors should be mindful that some students can be prone to losing balance when completing turns on sloped ramps and when moving their feet from one position to another. To assist the student to maintain balance, the instructor might need to provide physical support during the learning process or investigate the use of a support cane by consulting with a physical therapist. For a student with compromised balance, the turn mechanics can be modified by having the student assume the final turn position and then pausing to ensure they are stable before giving the directional command and hand gesture. Students with balance considerations may also benefit by sliding their feet into position rather than lifting them, so they minimize the period of single support and maintain maximum contact with the ground during positional changes. The student with residual vision. For the partially sighted student, the final goal is to be able to perform turns without needing to use vision. Reliance on residual vision can negatively impact posture and head position. However, useful residual vision can be used to assist the student to learn the positions and then faded by employing non-visual teaching strategies such as partial or total occlusion. The partially sighted student may anticipate turns and move their body into space before Juno initiates movement, or they may progress through turns too quickly. The use of occlusion can assist the student to learn to wait until Juno moves and follow the handle throughout the turn. The student who is anxious about walking through space or finds it difficult following Juno. Students who lack confidence may hesitate when following Juno through turns and can benefit from practice. Downcurb approaches, challenges, and considerations. In order to facilitate a straight approach, the student must maintain their following position and allow the guide dog to work to the down curb. It is common for a guide dog to slow down as the team approaches. The student must be able to maintain their following position even as velocity decreases, or else they may overwalk the dog and negatively influence its line. Practicing the maintenance of following position as Juno slows during a curb approach is important. The student with residual vision. A partially sighted student may not be used to stopping at all down curbs because they can visually scan for traffic as they approach and continue directly into the street. They may also not be used to waiting for a fresh walk phase at light-controlled intersections before they commence a street crossing. Students who fit this description need to understand it is their responsibility to maintain a guide dog's training and the team's safety by consistently stopping at down curbs and making accurate street crossing decisions. If a student's functional vision doesn't require them to use these strategies, or they feel their mobility will be made less efficient, then Juno may serve as a helpful self-assessment tool to decide whether a guide dog will enhance or hinder their independent travel. Partially sighted students may need to practice with following Juno to the down curb. They may get too far forward in their following position due to relying upon their residual vision rather than responding to tactile information from the handle. Partially sighted students may also attempt to use residual vision to locate the curb edge or high contrast features like truncated domes. This can cause a student to lower their head and change posture as they divert their gaze downward. This can impact their following position, attention to auditory and kinesthetic cues, as well as their awareness of information supplied by Juno. Use of occlusion can once again assist these students to learn to rely on Juno and not their remaining vision. The student who is anxious about walking through space or finds it difficult following Juno. Students who are anxious about following Juno may fall behind in their following position during a curb approach. They could be worried about falling if they overshoot the down curb, especially older students or those with balance issues. Others may be concerned about walking out into perpendicular traffic. A student who relies upon tactile rather than auditory and kinesthetic input for orientation and alignment may have initial difficulty with downcurb approaches. It would be beneficial for the instructor to spend some time teaching or revisiting non-tactile travel strategies. Street crossings, challenges, and considerations. The student with residual vision. Partially sighted students may sometimes anticipate street entries and step into the street before Juno responds to the forward command. They can also overwalk or rush Juno in a crossing and not maintain harness pressure. Being too far forward in the following position can cause a blocking effect, so that Juno is prevented from moving to the right. Over time, it can also cause a guide dog to lose pace and pull. Reliance on residual vision can result in a student not following Juno's line at the commencement of a crossing, or not following appropriately if Juno initiates a line change. For example, Juno may choose a line that seems wrong to the student due to the position of the upcurb or ramp on the other side of the street, or perhaps the intersection is skewed. The student may not be aware of this and chooses their own line based on visual information like crosswalk lines, traffic lights, or crosswalk flashers. Juno may need to make a brief line change during the crossing to avoid pedestrians. The partially sighted student needs to follow Juno when making these clearances. Relying on residual vision may cause a handler to lose their following position or use the handle to pull the guide dog back to the line they believe to be correct. Over time, this can create guide work issues such as the dog developing a left counter pull if the student has been pulling the handle to the right. The student who is anxious about walking through space or finds it difficult following Juno. Some students may hesitate when entering the street. This could be due to anxiety about traffic or concern about stepping off the downcurb. Hesitancy can cause the student's following position to become too far back upon street entry, causing various guide work issues, such as veering, a left counter pull, a guide dog becoming hesitant to enter the street, or excessive harness pull. Students who are anxious about stepping off the curb due to losing their balance can benefit by placing one foot down into the street before beginning the crossing, if it is safe to do so. Use of a support cane that has been provided by a physical therapist may also assist students with balance issues. The student being oriented to the intersection and having non-tactile travel skills is crucial. Without them, a student will have difficulties interpreting Juno's line during a crossing. This can impact the student's following characteristics and their ability to detect a veer and redirect Juno. Some students with orientation issues or hearing impairment may be drawn closer to or further from parallel traffic due to traffic sounds, which can affect their ability to follow Juno during crossings. Upcurb approaches, challenges and considerations. The student with residual vision. Students with functional vision may be able to visually detect the upcurb or ramp, particularly if there is good contrast between the curb and the road surface, or high contrast truncated domes have been installed. This ability may result in these students stepping out of the street without requiring Juno to stop. Students should understand that if repeated over time, this can lead to a breakdown in a guide dog's upcurb response. A partially sighted student may also use their vision to physically stop Juno at upcurbs, which can once again lead to a breakdown in the upcurb response. Failing to stop at upcurbs also removes the opportunity for a guide dog to receive positive reinforcement. This is because upcurbs are frequently used by guide dog handlers as a place to provide a food reward, so not stopping removes this opportunity. The student who is anxious about walking through space or finds it difficult following Juno. If a student is concerned about the upcurb due to anxiety about tripping, they may become hesitant about following Juno in the later stages of the crossing. This can cause their following position to become too far back, contributing to various guide work issues, including veering, loss of pace, or excessive harness pull. Encountering an obstacle, challenges and considerations. Students may need practice using correct body protection and scanning techniques to check all three planes. Incorrect scanning or probing technique can result in a student failing to locate an object. It is vitally important for a student to be able to discriminate between Juno walking offline to clear an obstacle or because of a change in direction. When changes in direction are unintended, the student has some options available to them. They can ask Juno to halt, investigate if there is a valid reason for the line change, regain their sense of direction, and then redirect Juno back to the appropriate line by giving the forward command with a hand gesture in the required direction. Alternatively, they can redirect Juno by coming to a sudden stop, which will indicate that an error has been made, and give a firm verbal hop up command with a hand gesture in the required direction. In class training, students are taught how to incorporate the leash to further emphasize the required direction. The ability to detect an error and redirect Juno requires the student to have developed the non-tactile travel skills and spatial awareness necessary to be dynamically oriented and to problem solve. The student with residual vision. One of the greatest challenges for students with residual vision is being able to trust a guide dog to make a line change to avoid an obstacle that is partially obstructing their path without using their vision to override the dog if they can see all or part of the obstacle. If the student can see an obstacle in advance, they can use this awareness to anticipate their guide dog walking offline to clear the object or having to stop. In these cases, the student can prepare themselves to follow the movements of their guide dog and give well-timed positive reinforcement. The partially sighted student needs to understand their residual vision may not always be reliable or may deteriorate over time, which makes trusting a guide dog even more important. If the student takes over the responsibility for making obstacle clearances, this will cause a guide dog's clearance work to degrade and lead to errors and possible safety concerns. Partially sighted students can benefit from practice with occlusion to learn to defer to Juno's decision and to use the tactile information available to them through the handle. When encountering obstacles that totally block the path of travel, a partially sighted student may advance from the halt position and get ahead of Juno to locate the object, which can be dangerous. A guide dog may show appropriate caution to an object by stopping a few paces short and require prompting to get close enough so as the handler can recognize there is an obstacle and be able to touch it. The partially sighted student needs to interpret this caution as a positive and understand the importance of not using their vision to move ahead of the halt position or force a guide dog to advance by using the leash or handle. This could cause a dog to become anxious or confused, or lead to a reduction in the amount of caution it shows toward obstacles. The student who is anxious about walking through space or finds it difficult following Juno. Students who are anxious about walking through space or experience difficulty with following Juno's movements will benefit from practice with following the handle to the left or right and adjusting their following position and walking speed during obstacle clearances.
I hope you found this video a useful resource. I'd like to emphasize the importance of orientation and mobility specialists in the preparation and support of clients wishing to train with a guide dog. Thank you. If you have any questions, feel free to contact me at Guide Dogs by calling 1-800-295-4050. You can also speak to one of our instructors. If you'd like to email, you can use the address information@guidedogs.com. There's also some very useful information on our website at www.guidedogs.com.